So welcome all. My name is Ajinkya Vinay Pawar and today I am here to explain you the topic about the history of pharmacy and the development of pharmacy. And second topic is the Pharmacopeia, that is IP, Indian Pharmacopoeia, and second one is the BP, that is British Pharmacopeia. So I'll try my best to make you understand and clear all your doubts related to these two topics. So here we'll start and get quicker look about the profession pharmacy. What do you come to know about listening the word pharmacy? So the pharmacy is an art and science of collecting, combining, preparing, preserving and standardization of drug and medicine either from a natural origin or from a synthetic origin. It also includes the good knowledge of drugs, the dispensing of drugs and the quality control of the drugs. So do you know from where the word pharmacy came? So pharmacy is a Greek word that is known as pharmakon and it means drug or medicine. So do you know who is the father of pharmacy? So the father of pharmacy is Professor William Proctor and Mahadeva Lal Shroff, also known as ML Shroff in India. And what do you know with the term pharmaceutics? Pharmaceutics is the drug manufacturing, preparing, preserving, then sales, then purchase and then the quality control of any drug is known as pharmaceutics. And after that we'll get a quicker look what is a drug. So the definition of a drug is it is any chemical entity which shows a pharmacological action in a human body or animals which helps us in diagnosis, treatment or cure from a disease is known as drug. So now we'll proceed to our main topic, that is history of pharmacy and development of pharmacy. So the history of pharmacy mainly includes four types of era. So the first one is the ancient era, which was from beginning to the 1600 AD. Then second one is the EMPERIC era, which is from 1600 AD to 1940 AD, and then the industrialization era, that is from 1940 to 1970, and the third one, which is the recent one, that is the patient era. So these dates and the years are very important to us. So what I think we can get a better understanding if we get all this listed on a proper way, systematic way on a whiteboard. So let's go. So the first one is ancient era. In this era, they use leaves, mud, cool water to stop bleeding. They use this method to animals. How they heal their wound? The pharmacy begins from that. In Baby Lover, earliest records of pharmacy by priest, the pharmacist was kept. The Hippocrates is also known as the father of medicine. The Mithridates, the father of toxicology. And the Cosmoindanian sense of pharmacy and medicine after fall of Roman Empire. Then Eberspacher written formula for more than 800 remedies. So the major advances in pharmacy during this period was the formulary, second one is the dosage form and third one is the pharmacy shop. In formulary, the continuous of documentation of knowledge of specific drugs information used by pharmacists. In dosage form, well no longer harvested from herb gardens, for example syrup, and in pharmacy shop first appeared in Baghdad in 1504 AD. In ancient India, source of drugs were of vegetables, animals and mineral origin. Knowledge of that medicine system was usually kept secret within a family. There were no scientific methods of standardization of drug. At the end of this era, pharmacy was separated from medicine. The second era is the EMPERIC era. The Pharmacopeia was a regulatory tool for pharmacists. Benjamin Franklin started first hospital with pharmacy and first pharmacist was Jonathan Roberts. Chemicals were identified with N2, Cl2, etc. The Western, also called allopathic system, come into India with British traits who later becomes rules. Under British rule, this system got state rank. Before 1940, initially all drugs were imported from Europe. Later some drugs began to manufacture in this country. In 1901, Eastern of Bengal, chemical and pharmaceutical work at Calcutta by Acharya P.C. Roy. In 1903, small factory at Parel, Bombay by Professor T.K. Gujjar. In 1907, Alembic chemical works at Baroda by Professor T.K. Gujjar. During World War I, 1914 to 1920, import of drugs were cut off. Inferior quality medicines and adulterated drugs were dumped. Markets were full of useless drugs were sold by unqualified men. The third is the poisoning due to quinine, selling of chalk powder tablets in place of quinine. Opium deals with cultivation of poppy and the manufacture, transport, export, sale of opium. In 1894, Indian Transfer Act levy of customs duty on goods including drug medicines imported or exported. 1990 Poison Act was regulated the impact poisonation and sales of poison. The third era is the industrialization era. First one is the Civil War, second one is Civil War I, which started in 1940 to 1970. More people got injured, ill, more production of medicines were made through industrial machines. Scientific research, investigation on medicines and their effect was done. On the basis of the research, many new drugs and old drugs were being used, which caused more reactions. The development of manufacturing of pharmacy began. Standardization, biologically prepared products, complete chemical synthesis, and increased use of parental modification. The fourth era was patient care era. Beginning concentration on research of to develop new medicines, research or modification was done. New drugs were developed had a lot of adverse reaction to drugs, so drugs review and monitoring was done. Patients' proper care was taken in making them understand about the medicines. It was established in Japan, then in China, then in Baghdad, India, Malaysia, and many other African countries. Hope so you are clear with our first topic, that is historic background and development of pharmacy. Now we'll further proceed to our second topic, that is our pharmacopoeias. And what I'm going to explain is IP, that is our Indian Pharmacopeia, and BP, that is our British Pharmacopeia. Before that, we'll first know what is pharmacopoeias. Pharmacopoeia comes from a Greek word, that is pharmakein means drug and poia means to take, and therefore it can be defined as any formula or preparation given to form a drug. The term pharmacopoeia was first used in 1580 in a book related to the drugs, and the book was known as Drug Compendium. It contains the list of drugs and the manufacturing of drugs, sources, natural origins, and the regulatory control of the drugs. The book is prepared under the authority of the government of the respective countries. These books are modified time to time to introduce the information available. In order to introduce new product and to keep the size of the book within limits, it becomes very necessary to admit certainty. We use drugs and act in each new edition of this book. Certain new monographs are added while elder are removed. The drug compendia can be classified as official and non-official. Official compendia are the completions of drugs and other related substances which are recognized as legal standard of purity, control, and strength. For example, IP, BP, USP, USSR. And the non-official book other than official drug compendia which are used as second drug reference source for drug. For example, Merck Index. So what is Merck's Index? It is Encyclopedia of Chemical Drugs. The first edition was published in 1889 and second edition is published in 1989 by Merck and Index Rowry. And in official pharmacopoeia, the Pharmacopeia of India in 1946, Government of India published Pharmacopeia list as a supplement of BP. After this list, Government of India first IP published in 1955. So we'll go with the first topic, that is Indian Pharmacopeia. The history of Indian Pharmacopeia began in 1883 when Committee of First India Company Dispensary recommended the publish of Pharmacopeia, and Bengal Pharmacopeia was published in 1844, which mainly listed most of commonly used in genus remedies. So here are the important dates which we should keep in mind. First one is the 1868, both the drugs of BP and indigenous used in India. The second one is the 1869, supplement of above publication with vernacular name. And 1885, BP was made official in India. In 1927, the published Pharmacopeia was recommended as National Pharmacopeia. 1946, Government of India published Pharmacopeia list. 1948, constituted permanent IP. In 1955, first edition of Indian Pharmacopeia was published. In 1966, second edition of Indian Pharmacopeia in revised form. So what revision means here? So revision means addition of new and updated information under chairmanship of Dr. B.N. Ghosh, and then R.G. Kal, who died in 1958. After B.N. Ghosh, Dr. B.M. Mukherjee was appointed as chairman. UP committee is supplement published in 1957. On 30th June 1978, IP committee was reconstituted by Government of India, Ministry of Health and Welfare, under chairman of Nityanand, Director, Control Drug Research Institute. The committee assigned work for health preparation of third edition of Pharmacopeia. Third edition in 1985 was again divided into two parts, that was in Volume 1 and Volume 2, which was published in 1989 and 1991. So the Volume 1 contains legal notice, preface, acknowledgement, introduction, journal notice, and monograph from A to P. So what is the key feature of that? Monograph of an official substances or preparation includes articles, definition, description, identification, packaging, storage, chemical structure, molecular formula, along with IUPAC name of the substance are also mentioned in case of API. What was in Volume 2? It contains monograph from A to Z. For the preparation of IP, the pharmacopoeias of other countries like BP, USP, USSR, etc. were consulted. So IP in 1996, the 4th edition was published. In 2007, 5th edition of IP was published. In 2010, 6th edition was published. In 2012, with DVD, and 7th edition was published. The 7th edition of IP was prepared by IP Commission on behalf of Government of India, Ministry of Health Welfare. Under the Drugs and Cosmetic Act 1940, IP is an official book which contains standard of drugs and related substances, including in pharmacopoeia, helps in licensing of manufacturer, inspector of distribution of medicine. IP in 2014 is presented in 4 volumes, in which 2,667 monographs, and first IP has 16 radiopharmaceutical monographs present. First time IP in 2014 included DVD with ROM. 577 new monographs were added, 137 API, 161 formulation monograph, 11 antiviral monograph, 10 antibiotic monograph, 19 anti-clonal monograph, 5 was monograph on biotech, 19 was new chapters and about 200 IP spectrum, 19 was new radiopharmaceutical monograph. Hope so you all are clear with IP now. Now the second one is the British Pharmacopeia. So the British Pharmacopeia is the official collection of standard of UK medical products and pharmaceutical substances published annually. The BP contains monographs for pharmaceutical substances, formulated preparation and other articles used in the practice of medicine. In 1618, first national pharmacopoeia by England was produced. In 1699, Edinburgh produced its own pharmacopoeia. In 1807, the Dublin in Ireland produced its own pharmacopoeia. The Medical Act 1858 ordered to fuse these three pharmacopoeias into a form of book called BP, that is British Pharmacopeia. So in 1869, first BP consists two sections. First one is the Material Medica and second is the Preparation and Compounding. The second one is the Preparation and Compounds. In 1867, second edition of BP was introduced. In 1898, fourth edition. In 1914, the fifth edition, and in 1953, eighth edition of British Pharmacopeia was introduced. The titles are in English instead of Latin and metric system. It has been published annually. I hope so I was able to make you understand all the concepts related to these two topics, the history and development of pharmacy and the introduction to pharmacopoeias, Indian Pharmacopeia and British Pharmacopeia. The question for you is, who is known as the father of pharmacy? The question is in front of you. Have a look and I'll tell you answer after 5 seconds. Till that, you try. So the right answer is Professor William Proctor. So second question for you is, who is known as the father of medicines? Yes, the father of medicines is Hippocrates. So this was all about these two topics, and at the last I want to say thanks for watching and best of luck for your future.